We will see any patient who comes through the door regardless of their ability to pay. But if they want to get into their doctor's office, it's a 2-month wait where we can get people in same day or next day.
Welcome to episode 84 of the LoraineCounty.com Insights Podcast. I'm your host, Ed Skimmon. I'd like to open up by highlighting the LoraineCounty.com champion sponsors: Lorain County JVS, Emerge Inc., Lorain County Community College, Community Foundation of Lorain County, WOBL Radio, and Lorain County Commissioners. Today, we're talking with Tammy Bertrand, Executive Director of Family Planning Services of Lorain County. Join us as Tammy shares how the organization has been serving the community since 1969, providing essential health care such as birth control options, cancer screenings, and physical exams, particularly for underserved populations. She discusses the critical gaps in healthcare access, the role of Title X funding, and the importance of community partnerships and volunteer support. Tammy also talks about her personal journey to this role and the future challenges and opportunities facing family planning services. Access to affordable healthcare is one of the cornerstones of a strong community. It ensures that people can work, raise families, and contribute without being held back by preventable health challenges. Family planning services plays a critical role in making that possible, especially for those that might otherwise go without care. Here is my conversation with Tammy Bertrand.
My name's Tammy Bertrand. I am the Executive Director of Family Planning Services of Lorain County.
Welcome, Tammy. Thanks for joining us and sharing your insights. Could you provide an overview of Family Planning Services of Lorain County and describe your role as Executive Director of the organization?
Family Planning Services has been serving Lorain County since 1969. It originally started as the Maternal Health Association, only for pregnant women, wanted to be pregnant, and it has evolved over the last 57 years with the community. So now we see both men and women. We reach about 4,000 patients a year. About 78% of them are at or below poverty. And we will see any patient who comes through the door regardless of their ability to pay. So I think it's a very valuable service.
Could you talk about the different services that Family Planning Services offers and who in the community are these programs here to serve?
We do basic birth control. So when a patient comes in for birth control option, they go over a wide variety of options that are available. 1970 is when the birth control pill went on the market. But a woman could not get the birth control pill without the permission of her husband. And if you were a single woman, oh, Lord, no, absolutely not. Wasn't even discussed. The doctor would send you packing. So we try to be much less judgmental here and treat each person as they deserve to be treated when they come in. And also keeping in mind that a large portion of our patients are at poverty. When they come in for some type of birth control, they haven't seen a doctor in many years. So the nurses will do a complete physical exam, including cancer screening, pap tests, breast exams, things like that. They do blood work. They test for high blood pressure, things like that, to get them all on an even scale to start with. Then they move forward with their family planning. You have people who come in because they want to have children. Other people just want to prevent it till they're done with school, whatever. Everybody's got their own needs.
What gaps in healthcare is Family Planning Services working to address, and how are those needs important to our community?
The biggest is lack of insurance. People are under the assumption that people who don't have insurance don't work. We have patients who have 3 or 4 jobs, and they're still barely getting by, and none of those jobs offer enough hours to get insurance coverage. So they can apply for Medicaid. And it's difficult because even people who have some insurance, it may be a $10,000 deductible, so they avoid getting health care unless they can't get out of bed. And somebody having a child when they're not ready to have a child affects not only their lives, but that child, because they can't afford to feed themselves. So it's just a snowball effect. And I think that's where we pick up where somebody with a full-time job and regular insurance can't do.
I know that collaboration is important in this kind of work. Who are some of your key community partners, and how do those partners help further your mission?
We work extremely closely with Lorain County Public Health. They actually manage our Title 10 grant, which is the federal funding for family planning services. We have been receiving that for 56 years. And this is the first time in our history that the federal government no longer thinks it's important. Projected funding for 2026 is zero. And that affects almost 4,000 clinics across the United States. So this is going to be an incredibly damaging event to happen for healthcare for the people at the bottom. And it breaks my heart. So Lorain County Public Health hold the grant and we do the work. So we work very closely with them. We also run a Healthy Start program through Public Health where we help postpartum women make sure they get their 6-week checkups. If they need a crib, we find them a crib. We work with other organizations like Public Health to get those things. We refer patients back and forth with Lorain County's free clinic as well as Lorain County Health and Dentistry. For an example, right now, that Lorain County Health and Dentistry doesn't have a reproductive care nurse, OBGYN nurse, but they will in December. So right now they'll refer their patients. So everybody tries to take care of the people in the community by sharing.
How is Family Planning Services funded? What are your main sources of support that keep your programs running? I know you mentioned the Title 10 grant. What are the other funding sources?
We have great support through the community. Community Foundation of Lorain County is a big supporter. They have a group underneath them called the Women's Fund, and we partner with them and United Way for the Change the Cycle program, which Women's Fund set up. And how that works is they did studies and found that a high percentage of young girls don't go to school when they have their periods because they can't afford product. So they're not leaving the house, which is detrimental to their education. And it's not something you should be ashamed of. It's part of our bodies. We get period products that we give away free of charge. We actually keep them in a basket in the bathroom so nobody has to come in and ask. And we get resupplied by United Way, but Women's Fund is who supports it.
What role do volunteers play, and how can people get involved in a meaningful way?
We have volunteers that help with supplies. And what I mean by that is also with a partnership with Public Health, we have the only harm reduction vending machine in Lorain County outside our office. And that's a combination. So, for example, Public Health supplies the Narcan kits, so fentanyl test strips, things like that. And then we get the period products from United Way, and that goes in for women's health. And then we supply everything else. So there's condoms and there's first aid kits, information on taking care of your body.
From your perspective, what are the biggest challenges Family Planning Services Lorain County is facing right now? I'm guessing the Title 10 funding.
That's the number one. Another thing that really hangs over us is everybody has a personal opinion about abortion and women's right to choose. And that is perfectly fine. This is still America, and you can have your own opinions. But I think it clouds a lot of people's perception of the healthcare and the hole we're filling here in the community. We don't do abortion. We will refer a patient if that's their choice. And we get some negative responses on our social media, especially from people who assume that that's what we do. And therefore, they take away support that's really dealing with people's basic health.
What are the biggest opportunities?
Our biggest opportunities are actually coming from individual people who don't like what's happening and don't like seeing rights being chipped away from people, especially women. So we've been getting a lot more financial support. It's not as much, obviously, as the big companies can provide and the big foundations, but in a way it's just as important because all those people collaborating together for a common goal.
How do you define success at Family Planning Services? What metrics and outcomes are important to you and your team?
We're always happy with our numbers. Just for an example, we have 2 very skilled and educated outreach coordinators who speak at 13 different school districts in our county. And they also do work with the Harm Reduction Center through Rivian, and they do testing and education at the Juvenile Detention Center, at the homeless shelter, at Genesis House. We try to be as involved as we can in the community where people are going to need services. And last year, they touched over 22,000 people. And to me, that is a big success.
Without using names, can you share a story that illustrates the impact of your work on an individual or a family in the community?
We actually had a fundraiser a couple of months ago, and we had 4 patients who came and gave testimonial. And it was so heartwarming because each person had a different point of view. One gentleman spoke who is a gay man, and he had said that it was bad enough for him growing up in Utah in a Mormon community and having nobody to talk to. But then to go to the doctor for help and be told, we don't do that. You have to go to a gay clinic. We have products now. PEP and PrEP are prevention services for people who are at risk for HIV, which we provide here. And he said that the first time he came in here, when he left the appointment, was the first time he'd been treated like a human being in a doctor's office his entire life. We had a woman who came in who had a issue as a teenager and needed counseling and birth control and was provided those services. And even after she moved away, went to college, joined the Army, was involved in other things, she still comes back here for treatment.
How do you envision the future of family planning services in the next 5 to 10 years? What changes or growth do you hope to see?
Honestly, my biggest hope is we stay open. Title 10 is a little over 40% of our entire budget. So it's something that we've never not had it available. Like I said, it's been 56 years. The Title 10 program was set up by actually President Nixon in 1970 to cut back on teen pregnancies, STIs, and things like that that were affecting the health of the country. And it's grown to thousands all over the United States. That is my goal, to keep this place open.
What is something people don't normally know about family planning services that you'd want them to know?
That anybody can get health care in this clinic. We actually have a big portion of patients who have full-time jobs. They have insurance, but if they want to get into their doctor's office, it's a 2-month wait, 6-week wait, whatever, where we can get people in same day or next day and have your problem dealt with and get on with your life.
If somebody wants or needs the services, how do they go about getting it?
I just call the office, or you can go online and send in a message for an appointment. We're at familyplanningservices.org, or you can call the office at 440-322-7526.
Let's switch over and talk a little bit about you. What's your background and what led you to your current role?
My background in Lorain County has been in nonprofit. I used to work for the Power of More. So I worked for 6 chambers of commerce. I did marketing there. And then I went to work at Neighborhood Alliance. I was their special events coordinator. And then when there were some funding issues with that, I ended up going over to Wesleyan Senior Living, and I ran their nonprofit foundation, which is very unique in the community because most senior communities, once you run out of money, they're packing your bags and telling you go find somewhere else. Where Wesleyan has a promise that even if you run out of your funds, you have your home for the rest of your life. So I was very proud to work there. My parents actually lived there. My mom had Alzheimer's, so she died. My dad was there for over 9 years. So I was very familiar with the people. I had relationships with them. But when the opportunity came over here at family planning, I'd had a lot of experience in fundraising, but didn't have a lot in reproductive health. But good for all of you, I don't do the exams. I'm back asking for money, looking for money, trying to keep things afloat. I've been here for 2.5 years now, and I'm just so proud of the staff and the impact that they have on the community.
In the 2.5 years that you've been here, what are you most proud of accomplishing?
I think bringing in more funds. They had funding from the places you'd expect, like Nord Family Foundation, Norton Family Foundation, Elyria Charities, George Gunn Foundation, the local things, but we've brought in a lot of new funders, including individuals, but I've had a lot of people say to me, "Oh, I thought you guys were Planned Parenthood." Didn't know that there were two different services here. There's no Planned Parenthoods left in Lorain County. Hasn't been for 2 years. But Planned Parenthood is a national organization that does similar services to us, but family planning has been a local important service for 57 years. We're proud of that. I don't want to pat myself on the back, but I am incredibly honored and proud that I'm picked as the Bright Star Chamber of Commerce. I've been in it for a very long time. I work on the membership committee. When Tony called, I was shocked. I don't know. I guess when you volunteer and stuff, you just don't expect. Just do it because that's the right thing. But I am very excited and honored and proud of that.
How would you describe your leadership style? Who or what has influenced your leadership approach the most?
I think it's been the staff that's directed me because I don't pretend to know everything there is on the medical side. I rely on them and their expertise, and they follow evidence-based studies and work for everything that they do. So I know every person who comes in here is getting treated extremely well. And they also are very non-judgmental because we'll have patients from all different walks of life, things where you would shake your head and think, how did you get in this situation? But that's not our job. Our job is their health care. And everybody here's been long-term, except for me. Our clinic manager has been here for 31 years, med tech for 18, front office 17 years. We have a lot of experienced people, and I have really learned so much from them.
Outside of work, what are your interests and hobbies, and how do they help recharge you?
I'm a grandma, and I have a granddaughter and a grandson, and I can't even put it into words how it has just changed my outlook. You raise your kids and they grow up and they move away, and it's just you and your husband looking at each other on that big table. And then to have these little people in your life, it just recharges me every day.
Finally, where can people go to get more information about family planning services and connect with you?
They can reach out to me at tbertrand@fpslc.org, and I will get them connected to what they need.
Thank you, Tammy, for joining us and sharing your insights.
Thank you.
Thank you for listening to the LorainCounty.com Insights Podcast. Each episode, we share conversations with the people shaping life in Lorain County, from business and government to education, nonprofits, healthcare, and entertainment. Be sure to follow or subscribe on your favorite podcast platform so you never miss an episode. You can also visit LorainCounty.com to discover local events, volunteer opportunities, and more community resources. If you know someone who's making a difference in Lorain County, send us a note at podcast@LorainCounty.com. We would love to share their story and insights. Special thanks to our producer, Leah Gerke, and to you for listening. This has been the LorainCounty.com Insights Podcast. Conversations with the people shaping Lorain County.